Hello, I'm Dr. Aishwarya. I'm a fertility specialist practicing in A4 Fertility Centre, Chennai. So, let's talk about ovulation induction today. So, ovulation induction means we make your ovaries produce an egg, that is called inducing. Inducing means starting, making a person or making things start to do something which was not done earlier. So this is usually the first or the most simplest form of treatment that we have as far as fertility is concerned. So whenever a lady who comes for any fertility specialist or a fertility center, the most important question that arises in her mind is, will they do IVF for me for every other condition? See, you have to understand that it is a complete myth. Not all fertility treatments are actually IVF or test tube babies. We have some treatments ranging from the simple treatment to the most complex treatment and treatments even beyond IVF. So we cannot do a blanket treatment for everybody, and it's usually a personalized care. So as I told you, the ovulation induction is the simplest treatment that's available. So usually when a couple comes to us for evaluation, we usually take the basic history, see some simple blood tests to look at how many eggs they can produce, called as the AMH, how many sperms they can produce, that is seen in the sperm analysis. And if everything is normal, or we find out the lady is just not able to produce eggs, which happens in most cases, especially when the lady has polycystic ovaries, then we suggest this simple treatment called PCOS. So usually this treatment is started from second day or third day of the cycle. We call the woman, we scan her, vaginal scan is usually done, and then we start her on simple tablets. The second question that comes is, will these tablets create any trouble in future? Absolutely nothing. All the tablets have their own half-lives. Once the half-life is over, everything is going to go out of your body. There's no question of any long-term side effects of such simple medications in your body. Be it even the IVF injections, they're not going to create much trouble. So we usually give the tablets and call the lady back for a scan on the 10th day, the 12th day and the 14th day and so on, to see if there is an egg that has been produced, which is what we aim for. Most women, 80 to 90% of the women, respond only to tablets alone. But there are a handful of women who do not respond to the tablets alone and would require an additional support with injections, which are basically the hormonal injections. These are the natural hormones that are produced in the body to produce an egg, which may be absent or which may not be produced in the right amounts in your body. So we pump them from the outside, and then this also aids in the production of an egg in the lady. And once we know that you're going to produce an egg, at that point we would ask you to have intercourse with your partner. Sometimes we also have an additional injections to rupture the egg and then ask you to have intercourse with your partner. So all that we are going to do in your cycle is just produce an egg. We just aid you produce an egg, and this is called ovulation induction. We are not going to do any magical treatment in this. It's just the simplest form. And did you know that if the problem is only production of egg, most women fall pregnant within 3 to 4 cycles itself. So this treatment is definitely suitable for young women with no other problems but production of egg, with good sperm factor and good tubal factor. This would be the treatment of choice that we do. Thank you.